I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor.
Menopause is not a prescription. I'm going to say it again. Menopause is not a prescription. Before we get too deep in the episode, I want to invite you to something. One of my goals is to create access to better information, to cut through the noise of what you experience online. There's not just a plethora of choices in the online space, but there's also a plethora of opinions. Whereas in medicine, maybe there's space for some opinion, but there really needs to be mostly space held for the facts or what we know to be true in this moment based on research. And I've actually pulled together a collection of over 25 of the people that I consider to be some of the best menopause clinicians in North America together for a free event. And I would love for you to join us. It's called the Modern Menopause Summit. And the reason we chose that name, and I'm co-hosting the event with my colleague, Dr. Cara Denisio, who is maybe the best known menopause naturopathic doctor in Canada in this moment. If you haven't met her, I'd like you to meet her. We're co-hosting this event with a goal of bringing you the evidence-based information you need to make decisions about your menopause in this day and age. What we know to be true right now about hormone replacement therapy. What we know to be true right now about your metabolism. It's a free event. It's running for an entire week and has more than 40 topics that we're covering over the course of that week. The link to sign up for it is in the show notes of this episode. I want you to go there and click it, pause for a second, go there, click it, sign up. Like I said, it's free. The purpose of this is to really expose as many modern menopausal people or people that are knocking on the door of menopause as possible to the best practices in menopause in what we know right now in 2024. I can't wait to share this group of individuals with you. You may find your next doctor in this group. They practice all over North America. I'm often asked where to find a practitioner outside of Ontario. This is going to give you a great idea of who you can connect with. It's also going to give you the language and confidence you need to go see your own doctor about your menopause. So menopause isn't a prescription, and there's nobody happier than me that women are actually able to access hormone replacement therapy through their primary care provider more often today than they were in the past. I think the noise level, and I mean positive noise, the outrage noise level of menopausal practitioners and menopausal people over the last couple of years have actually been noticed, right? It's been noticed. And we've had organizations come forward with very strong position papers that show that hormone replacement therapy is the gold standard for supporting people in menopause. We've had organizations, even like the Canadian Family Medicine and Canadian Medical Associations, come forward and say, this is the right thing to do for people in menopause. And that's been really missing, or the emphasis on hormone replacement therapy has been missing from the conversation of menopause for so long. We just told women that they now suddenly had high cholesterol. We just said that people have difficulty managing their metabolism and their weight as they get older. We never really acknowledged the most significant hormone transition that people went through in their lifetime was connected to the majority of health changes that happen in that fourth, fifth, and sixth decade of people's lives if they're born with ovaries. We were underappreciating how detrimental menopause was in the workplace. We underappreciated how many people actually left their positions because they felt like they couldn't go on in the workplace because of their menopause symptoms. And you know what? We got loud. And it's amazing. And what's amazing about it is that I actually do see the change. I actually do see that more family practitioners or non-menopause practitioners are comfortable prescribing hormone therapy. The fact that I even need to say that teaches you a lot. Like, are they comfortable prescribing a medication for cholesterol? Are they comfortable prescribing an antibiotic? But for some reason, we've had to let your doctor get comfortable giving the gold standard treatment for your menopause. You can hear it in my voice, how irritating this actually has been. And now you can get a prescription. I've watched the pendulum in medicine swing in lots of different directions. And usually it's with nutrition, right? Where we, this is amazing and this is terrible and now this is terrible and this is amazing. It's very common that when we learn new information or when we put new things into practice, that we start to overemphasize that one piece and de-emphasize all the other things we've ever known about that thing. Menopause is not a prescription. So although I'm incredibly happy that there are more prescribers, there are more people that have raised their hand that said, sure, I'll follow the literal gold standard and treat these women the way that they are supposed to be treated, and we're supposed to be excited about this and clap. But when the pendulum swings, we rarely get it right. Because now we're prescribing treatment for menopause in appointments that are 7 minutes long. We're prescribing medication for menopause in a 7-minute appointment squished between an ear infection and a diabetic patient in family medicine. We're squeezing that prescription into a 7-minute appointment, and in that appointment, we can't really manage your side effects, your questions, the individualness of what maybe should come along with that prescription. And 100% I can guarantee that in that appointment that you get that prescription, you don't get 99% of the treatment that's required to actually have a healthy experience in menopause. Because hormone replacement therapy, and I'm a prescriber, I'm a huge fan, obviously. The hormone therapy part of your menopause care is a fraction of what's actually required for you to be your best. It's rare that giving the first prescription the first time leads to no questions, leads to no side effects, leads to no bleeding episodes. It's rare. If it was as easy as giving an amoxicillin prescription, which has a start date and an end date, and 90% of your ear infections are going to go away with this prescription, we'll just see the resistant cases a second time. You finish it on your own. You know what the side effects are. You can always talk to the pharmacist, right? But you finish the prescription. Lifelong prescriptions or very long-term prescriptions for many conditions are not as nuanced as prescribing for menopause care. And in most other areas of medicine, when we prescribe something that someone's going to be on for a long time, we don't have a ton of options as far as where they go with it, right? We started at one dose and slowly increase the dose if that doesn't work, right? We change the prescription to a different brand if we need to, and then increase it if we need to. We add a second prescription if their blood pressure is not controlled by the first prescription. There's a systematic way of making those changes. Whereas in menopause care and with menopause prescribing, and after being a prescriber for the last 10 years, I can tell you it's rare for it to go that way. And it's not because I'm not following the standard of care. It's because the literal nuance of working with people in menopause means that more comes up with that prescription than most other prescriptions. We also want you to be on it for a long time to see the benefit. And it's technically the cherry on top of all the things you need to do for your health in order to feel better. Prescriptions are amazing, But prescriptions also need to be managed. And my guess is, and I'm going to make a little prediction here, but we've swung the pendulum now, where we now have more prescribers, we now have more family practitioners who are willing to give, again, the gold standard therapy. They've said, fine, we'll do it. But this prescription needs to be managed. It's very common when I would give a prescription for hormone therapy that patients would take it home and then they would come back with questions. I forgot my aunt had breast cancer. The black box warning on this vaginal estrogen cream says that I shouldn't take it or I'm going to get a stroke. I forgot to mention that I had a bad reaction to the pill when I was in my 20s. Is this going to be the same? I talked to my sister about it and she's decided to do pellets. There are more questions about this prescription than anything else I've ever done in my career. And arguably, it's relatively simple compared to lots of other things that we do in my career. This raises the most questions. We also have the most troubleshooting to do with this particular prescription. Patients have breast tenderness. Patients sometimes will have spotting or bleeding when they start their hormone therapy. Patients may experience some other changes that we need to make sure that aren't from their prescription. This is a really complicated time in your life. And when we add a prescription, it's common that patients start to have other symptoms show up because they are transitioning into their menopausal years. And so their mood may get worse in the same 3-month window that we've started their hormone therapy. Was it the drug, or was it that time passed and you actually are experiencing more symptoms related to your menopause and it's not a side effect from your drug? Figuring that out is actually quite nuanced conversation and takes way longer than 4 minutes. Those prescriptions need to be managed. We need to troubleshoot. And in my experience, if you start HRT the moment you technically qualify for it, which would be in perimenopause, we may actually see additions, subtractions, or changes to your prescribing or your prescriptions over that 10 years that we maybe expect you to be on it or longer. You may start just with vaginal estrogen and then progress to just progesterone. You may start with estrogen and progesterone and then the doses need to be changed. Right? You may start with estrogen and progesterone and have a hysterectomy and you can drop the progesterone, right? There are a lot of changes that need to happen with this prescription that require more discussion, more troubleshooting, more education than anything else I've ever done in my work. And now we're doing it in 7 minutes. As long as you had nothing else to talk about, which brings up the second point. There's like the whole other part of your health, right? There's the rest of your health. And HRT is amazing. And I think the more we learn on it, the more we study it. I don't like to make predictions about HRT because people will think I've written that in blood and then go see their doctor and say, Jordan said that, my HRT is going to prevent me from getting dementia. And although we're really excited about the direction of research on brain health, especially in patients who are maybe the gene carriers for increased risk for dementia, it's not proven yet that that's what it does. And so we don't say things like that with absolute certainty, even though it's cool, and hopefully in the future we can say it with more certainty. But the things we know for sure that HRT does are incredibly important, but they also really shouldn't be the only thing that's done to help support those areas of health. And if we looked at menopause and the areas of your health that are going to be influenced by menopause, right? We're talking about your cardiovascular risk, we're talking about muscle mass loss, we're talking about an increase in adipose or fat tissue. We're talking about a loss of bone, right? And osteoporosis risk. We're definitely seeing changes in brain health, and some of them we recover from, right? Some of the brain fog and some of those pieces we adapt to and recover from. We also see changes in sleep. We also see changes in your mood and your motivation and your appetite and the way that you try and make yourself feel better changes in menopause. And when we add HRT, that doesn't necessarily mean that you now can manage your 60-hour work week. It doesn't mean that you can skip the gym. It doesn't mean that your nutrition doesn't matter. It doesn't mean you can get away with eating no protein and nothing bad happens. There are a lot of things that come with menopause care that have nothing to do with your prescription. Or that your prescription technically is just propping you up so you can sleep through the night so that tomorrow you can set better boundaries and you can actually go to the gym and eat some chicken. And so I think when we swing the pendulum so far in the other direction to say, we want to put vaginal estrogen in a vending machine, which truly I believe that should be the case. We want to put vaginal estrogen in the vending machine. I've never wanted to be the gatekeeper to prevent someone from getting vaginal estrogen. However, that person who needs vaginal estrogen needs more discussion than the vending machine is able to provide. And so if we reduce it down to prescriptions, what are we doing? Right? We're leaving women to feel pretty alone, actually, in this whole process. When that education and that framework for that woman to have support in her life and people that have graduated into menopause above her having lots of knowledge to bestow on her, that doesn't exist. She doesn't have that person in her life, right? The people that are transitioning through menopause right now they're doing it first, right? When my daughter gets there, it'll be a very different conversation. Just like her puberty experience has been a very different conversation than mine was or my mother's was. But the women who are going through menopause right now, they're the first ones. They have no one to look up to. They only have the group of us looking up to them going, gosh, I hope this is better than generations before. But when we reduce your menopause down to a prescription, we make it sound like this is something you can medicate your way out of, which we can't. It also makes it sound like it's like this deficiency and it's something that needs to be corrected with medication, which it's not. And it also makes it sound like HRT is the most important thing, and it really isn't. And so when we created that Modern Menopause Summit, which if you haven't signed up for that, now I hope you go do it. If I have not convinced you quite yet, I will now. Is that conversation about HRT needs to be quite empowered, right? There are still many clinicians who have not raised their hand and said, I'm not comfortable prescribing hormones, or I don't believe in hormones. And if you can't get a new prescriber, a new clinician, then going to the summit's going to give you what you need to be more empowered and hopefully be able to fight for that. But the other thing we're going to do is talk around all of those other pieces that are absolutely necessary for a positive menopause experience. Because putting HRT on an overbooked calendar with low focus on nutrition and exercise and mental health and bone health and whatnot is like putting a Band-Aid on a canyon, right? And being like, well, hopefully this holds it all together. And if you're underwhelmed by your prescription that you already have, right? If you're like, this didn't change my life. This didn't do what I hoped it would do. This didn't make me feel 30. It's probably because there's another part of your health that's screaming for support, that's screaming for a conversation that you need to be educated on so that you can consciously make decisions every single day about what it is like to be a menopausal person. That's why we're doing the summit. Because I wanted to have conversations about your metabolism, about your bones, about how to help your partner support you. And actually, when we decided to approve that topic, I was like, that might be the most well-attended talk of the entire thing. How can you show up in your workplace as a menopausal person? How can you advocate for support in your work? What does the impact of stress, like what is that doing? Right? There are a lot of pieces that are the actual framework for how we build good menopause care, and none of it has anything to do with your prescription. So like I said at the beginning, there's nobody happier than I am that you now get a prescription for your menopause. And if you don't have one yet, the group of individuals who are willing to prescribe is growing. And so you're going to have some choice soon. But I want you to deeply know that getting that prescription in that 7 minutes isn't enough, right? It's not enough to actually answer your questions. It's not enough to help you troubleshoot, and it's really not enough to help you build a life in menopause that is helping you with what your actual goal is. Like the reason you went and got a prescription wasn't just because you wanted no hot flashes. Why was it? Because it's really common, actually, that we kind of distill medicine down to like symptom solution, like symptom fixing. What do I want? I want less acne. What do I want? I want no hot flashes. But like, what are you actually asking for when you're asking for that? Because my guess is that's not where your desire ends. You're not saying, I just don't want to have hot flashes. Everything else is fine. Every time I say that, I always think of that meme where the dog is like in a burning house and drinking a cup of coffee saying everything is fine, right? Just trying to fix your hot flashes and not doing anything else is kind of like that picture. And being like, everything's fine. Now I have HRT, everything's fine. Except it's not. And I think if we don't expand the discussion around what good menopause care looks like, we're going to reflect back on this decade and be sorely disappointed with the results we got. We're going to have people write papers that are like, we gave billions of women HRT and not that much happened. And it's because it's not about that. I need you to sleep through the night. I need you to have less hot flashes. I need you to chemically and hormonally not be wired for depression. And HRT is very positive for all of that. But I also need a lot of other things to happen to have you feel your best, which is probably what your actual deep desire is, not just the lack of a symptom. And this is a really good reflection point because when we're usually talking about health, we talk about the things we don't want. I don't want to be tired. But what do you want instead? What is the absence of tired? Is it just not tired? Or is it thriving? You just want to like not sleep badly? Or do you want to wake up after 8 hours and be like, I'm going to take over this day? But if we only, again, distill it down to the absence of the symptoms of menopause, we have failed you. Because we've failed to actually help you thrive. We've failed to actually teach you what's even possible. Because again, you have nobody to look up to. You can't look at the generation of women before you and go, how long could they work before they had to tap out? How much were they able to support their grandkids before they had to say they're too tired? How much were they able to contribute to their community before they couldn't because of their mobility issues? You don't have great role models in the generations before you. You're it. You're the group. You're the group we're going to aspire to be like. That's why we called it Modern Menopause, because you actually don't have a role model. You're going to create what's possible. But that's only possible if we as your clinicians show you what's possible. And what's in the research is so incredible, right? The way that we can support and teach women to take care of themselves, the way that we can support and teach women to exercise so that they have muscles longer, that their mobility and independence is not so compromised by their menopause status. The research on that is incredible. I'm not trying to sell you this pipe dream that doesn't exist. I'm actually asking us to practice what we have evidence for. We have evidence for how we should support you in menopause. And the evidence says it's not about a prescription. I hope you decide to join us at the summit. Like I said, it's free. And even if you can't make it live, sign up anyways. There's lots of tidbits. There's lots of connections. There's lots to learn, and we're excited to share it with you. So throw your email in the sign-up form. At least get connected with that event because it will help change the way you experience your menopause care this year. I hope that I've inspired you today to think differently about your menopause care. And if you've been dying for a prescription, I understand why you focused all of your efforts on that one piece. But let's remember that that's the cherry on top to a very, very amazing Sunday that we can create if we acknowledge all of the things that happen when we reach that stage of life and all of the areas that we can work on, not in a negative way, like in a very positive way, to help you actually achieve your best health and your best decade yet. That's what modern menopause actually looks like. I hope I see you at the event.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.